Hello everyone, this is Dr. Nasser, and in this clip I would like to discuss hemolytic disease of newborn. Hemolytic disease of newborn often is an immunological disorder in which the mother is going to produce antibodies against antigens that she does not have, but those antigens are present on red blood cells from the fetus. If these antibodies are a specific type of antibody known as IgG, because of their very small size, they are able to cross the placenta and they will directly attack the fetal red blood cells and coat them, and then fetal spleen will remove those red blood cells, causing severe anemia. In very severe cases, it will result in hydrops fetalis, which basically is still birth. The fetus dies in utero. In this smear, you do observe a degree of anisocytosis when you compare the size of the red blood cells to one another. You see some polychromasia present in the smear. You do see abnormal morphologies. It looks like a schistocyte in here. However, this appears to be like a schistocyte, a fragmented red blood cell. There are many artifacts in this field. If you have a red blood cell inclusion, when you focus up and down with your fine adjustment on your microscope, if it becomes glassy and shiny, that is an artifact and not a true inclusion. They should not be reported. We observe a blue dot in this area. That is also an artifact, is a remnant of the staining and inadequate washing. Hallmark of this smear is the presence of nucleated red blood cells. And there are two factors. One is their sheer number. There are a lot of them. Every field has nucleated red blood cell in it. But more importantly, you do see nucleated red blood cell in different developmental stage. In here we have basophilic normoblast, which matures into polychromatophilic normoblast, and finally it is going to become orthochromic normoblast, which at that stage the nucleated red blood cell loses its nucleus in the bone marrow, and the reticulocytes, or the young red blood cell without the nucleus, enters the circulation. Focus on the density of this orthochromic normoblast, because other stages of the red blood cell development, they have a very unique nucleus. Of course, the cytoplasm looks like polychromatophilic red blood cell, but the nucleus has this cobblestone pattern with darker and lighter areas in very close proximity. To my knowledge, there is no other cell with this type of nucleus on the blood smear. So red blood cell nucleus either is going to be at late stages very dense in orthochromic normoblast, or it would be cobblestone in earlier stages, but it should be easily distinguished from other cells with nucleus on the smear. Overall, when you review the fields, you notice that nucleated red blood cells are everywhere. Anisocytosis is everywhere, and polychromasia is also everywhere. I note the presence of echinocytes, these crenated, wrinkled red blood cells, but the way that they appear to me, it seems that these echinocytes are artifacts and is because of inadequate or improper staining procedures. To me, those are not true echinocytes. They appear to be result of problem with fixation or staining. So in any case, I will not report the echinocytes in this smear, but I will report polychromasia, the presence of the nucleated red blood cells, as well as anisocytosis. And I will look at other fields to see whether or not there is any other morphology that I should report, which in this case, I do see schistocytes. I had seen schistocytes before in this smear, so I will report schistocytes as 1+. In here you have a polychromatophilic normoblast going to become a orthochromic normoblast, which in this cell actually is disposing of its nucleus and becoming a polychromatophilic young red blood cell that will be a reticulocyte. Another, this is orthochromic normoblast. Look at the dense nucleus of this cell. Quite often you can see that this nucleus is going to be pushed to one side of the cell, and the presence of nucleated red blood cell testifies to the significant anemia in the patient, and it is an attempt by bone marrow to compensate for low red blood cell counts and inability of the body to carry oxygen.